I am excited to start us off. So my name is Kyu Rhee. I serve as the CEO and president of the National Association of Community Health Centers. But I like to introduce myself as just a primary care doc. I trained in internal medicine and pediatrics. I was fortunate to be a National Health Service Corps scholar and work in underserved communities in DC and Baltimore, and then also work in the public sector at HRSA and NIH. And then the last 13 years before this great role in the private sector at IBM and CVS Health. So I am excited to have this opportunity to introduce this important session around Imagine a Nation Without Primary Care. If you think about that, what is that like? It's like life without clean water, right? Or fresh produce. You know, primary care is so core to what we need in our healthcare system, yet for some reason it is so challenging, as I've witnessed throughout my career in the nonprofit, the public, and the private sector, to find ways to assure that our US healthcare system values primary care. So we've got a great program ahead. I'm gonna highlight the fact that, if you look at down, oh yeah, I pressed up, that's it. That's me, I know that. So we've got a great program here as we look to, what I love, if I were to simplify what you have to do when you think about this and the opportunities to advance policy, you have to tell stories and you have to have statistics. So the power of policy change, as I did a degree at the Kennedy School of Government at Harvard, and I remember, you know, these windows where you have these great programs, these passages of laws like the Ryan White, you know, Act to fund HIV/AIDS, you know, even the Community Health Center movement, as it started in 1965 with the story of Geiger Gibson and the Mississippi Delta. You need the stories. And so, as we think about the state of primary care, just like we would do as a clinician, as a primary care clinician, what are our vital signs as it relates to primary care? Where are we today? What does the pipeline look like? What's the amount of money we're spending in primary care? And what is our opportunity to address those vital signs and improve those numbers? So we're gonna get that. We're gonna talk about innovation, or workforce, yes, and then innovation, and then the future of primary care with 3 great panels, and then we'll close out with Sean and a wonderful reception. So as you know, part of the challenge in our healthcare system, when I taught at the School of Public Health at GW, I said, if there's one word that represents the US healthcare system, it's fragmentation. And the challenges we have with the silos that we have, whether it's silos around data, silos around how things are funded, but the importance of partnerships and partnerships across the nonprofit, the public, the private sector, these partnerships are so essential for us to think about transformation and making sure that we have a strong foundation, a strong primary care system. So whether that is professional societies like AFP, ACP, AAP, whether it's nonprofit entities like NAC, the National Association of Centers, whether it's payers like Humana, whether it's important innovators like Village Medical and ChenMed. It's important to think about all these stakeholders and the fact that we're very proud to be a founding partner at NAC, but we're also very proud to be in partnership with all of you as we think about this future and as we think about where we need to go, but also take a state of where we are today. So these were 2 articles. So I don't know if you know, for those, I'm going to talk a little bit about community health centers. We're very fortunate. Health centers have been around nearly 60 years. 1965, War on Poverty, Civil Rights Movement. Started with 2 health centers, one in East Boston, one in the Mississippi Delta. And over 60 years, we've had bipartisan support. And highlighting the fact a couple weeks ago, we had the first increase in nearly a decade, a 10% increase where the House, the Senate passed with overwhelming numbers to increase funding for our nation's largest primary care system, community health centers. We were on the front page of the New York Times. There were a couple health centers highlighted there. Bethesda Health Center in Texas and Family Health Centers Louisville. There was also AP News article that was covered, had 1 billion hits within a week, talking about health centers. That was Urban Health Plan in the Bronx and the Delta Health Center in rural Mississippi. This highlights the importance of what I was saying before. Our ability to have stories and statistics to talk about the challenges of primary care, to talk about what's working, what's not working, and what needs to be done with policy and policymakers to improve those investments in primary care and improve the outcomes that we know primary care delivers in communities all across our nation. This was a study that we did in partnership with the Graham Center related to the gap in primary care last year. And it was a very key component of our policy advocacy when we went to members of Congress. We showcased this study that showed 100 million Americans lack access to primary care. And the importance of addressing this gap is incredibly important. And so health centers serve currently 31.5 million Americans plus, 1 in 11. We have over 300,000 staff. We're patient governed, we're nonprofits, we're in communities that need it the most, in rural, frontier, urban, and island communities. I've been fortunate in my first 7 months as CEO. I visited over 50 health centers, over 20 primary care associations. There are 54 primary care associations across our nation. And I've had the opportunity to witness firsthand the work that they do in a transdisciplinary way, a team approach. Primary care is not just about a doctor. It's not just about a nurse practitioner or a PA. It's about this whole team that includes behavioral health, oral health, social health, often community health workers, and pharmacy services, pharmacists. And so the last slide here that I'm going to highlight is, as we look, as the National Association of Community Health Centers, as we look at the prescription that we need for our workforce in primary care and the investments that was just recently passed, like increasing the pipeline, teaching health centers. So Match Day was just last week. 1,200 medical students were matched into teaching health center sites, which is only around 100 teaching health centers in the country. There's about 120 planning grants that want to get funding. I believe every health center should become a teaching health center. I recall when I went through medical school how hard it was to think about doing primary care, because all my colleagues around me were excited about all the specialties that we were surrounded with, all those specialists who were talking about, the work they were doing, which was impressive, but wasn't necessarily aligning with what I thought about the importance of primary care and working in a community-based setting. And so studies have clearly shown when you go into the teaching health center program, 63% of those people go into primary care, 54% go into underserved primary care. That is an important investment that we have to make, and I think that recruitment, that pipeline is incredibly important. I was also a National Health Service Corps scholar. I got the funding. I was immigrant parents. My parents were like, came here poor. They're like, wait, you're gonna be a primary care clinician after all these years of training, all this debt? And I'll tell you, the fact that I got the National Health Service Corps scholar helped them feel more comfortable and helped me feel more comfortable about what I knew was the right choice. And so those types of investments are really important for recruitment and retention. And then I want to be simple about it. A lot of what I've seen in healthcare, whether it's how the money flows, the data flows, it comes down to payment and payment reform. If we're only getting, as the Milbank report I think is 4.7 cents on the dollar, that's not sufficient. So I grew up during Ghostbusters, watching Who You Gonna Call? So in my opinion, who you're going to call when you need value-based care? You're going to call your primary care team. Ultimately, we're the ones who are going to prevent the costs of hospitalizations, unnecessary specialty visits, unnecessary ER visits. We're going to reduce the cost of care. And as the Congressional Budget Office just determined, for the first time ever, despite nearly 6 decades of legislation to support health centers, they finally determined that health centers save money, $700 million. So I think this movement towards demonstrating the statistics, the impact of reducing costs through primary care, which Starfield and many studies have demonstrated, is going to be essential as we move that 5 cents on the dollar to ideally, I'm just going to call it out, 25 cents on the dollar.